Family and friends of individuals living with dementia are experiencing caregiver burden. The distressed sandwich generation feels a sense of responsibility to take care of their children and their aging parents. Often, when this happens, older adults are escorted by their loved ones, police, or paramedics to hospital emergency rooms across Mississauga and the Halton region. Caregiver Compass is a social enterprise to compassionately support caregivers using a person-centered approach when coordinating care. Service users would have the option to seek help with dementia-focused services such as home safety planning, monitoring and assessing responsive behaviors and cognitive decline, coordinating short-term respite care, finding suitable assisted living and monitoring the home transition, providing insight into medication management, advocating to retirement homes on their behalf, healthcare system navigation, such as speaking with the LinCare coordinator and/or accompanying older adults to their physician appointments if their caregiver is unavailable, sourcing community resources such as bereavement groups, recreational day programs, and spiritual or volunteer opportunities, as well as education on advanced care planning and end-of-life issues. Caregiver Compass will be comprised of an interprofessional team of social workers, occupational therapists, experienced registered nurses, and admin. This consultation service would lift some of the weight off the shoulders of caregivers by providing them with a tailored service to enhance their work-life balance. Caregiver Compass aims to be a trusted source for families to understand and implement at-home dementia care. The main funding source would be direct billing of private insurance companies. Many caregivers who are in their 50s and up are covered by their employer to access a registered social worker, and their parents have OHIP and private insurance coverage. Caregiver Compass would charge an hourly rate whereby we would meet in the client's home and start where the client is at. We would partner with at-home nursing and PSW businesses such as Nurse Next Door to de-escalate and resolve conflict between staff and individuals with dementia. This partnership would be mutually beneficial as we would be connected to high-needs individuals that wish to stay at home. With permission from families, we could provide a higher quality of care during their time of need. We would charge individuals for the service. Later, when we receive positive feedback, we may charge the companies as well. Another source of revenue would be to charge these businesses for staff training. Also, the Alzheimer's Society would be a partner to utilize. Similar to drop-in legal or tax clinics, we would schedule times to provide free of charge or sliding scale, one-to-one, confidential consulting at their locations. This would benefit those without insurance and increase our organization's presence within the community. Similarly, another clinic opportunity would be to partner with HMC, a Halton Settlement Agency. We would be able to assist newcomers by using their in-house translation services. These two agencies' 6 office locations would cover Mississauga, Burlington, Milton, and Oakville. The hospital system's biggest flaw is it uses a reactive approach rather than a proactive approach to medicine. Currently, seniors' mental health outreach teams triage based on ER visits and urgent notes from primary care. Newcomers and others without family doctors are neglected until they are brought into hospital, which is an unpleasant, traumatic, unnecessary experience. When older adults are in hospital, they face a higher likelihood of being deconditioned and unable to return to live independently. Larger retirement homes and long-term care homes see an influx of these vulnerable people. Behavioral Support Ontario and outreach teams do not have adequate resources to support high-needs families as they are often monopolized by these larger institutions. Caregiver Compass would monitor and advocate for busy families. Currently, retirement homes are unregulated and can upsell memory care units as high as $10,000 per month. Disruption would be seen when retirement homes stop using scare tactics and intimidation and stop blocking high-needs individuals to their suites. Caregiver Compass would liaison with older adults to ensure they have what they need. Ultimately, dementia would be seen as more manageable, and emergency rooms would be for emergencies.